Yeah, I do say what is on my mind, and I've always been like that. Listen, I don't want you to tell me if I'm doing good. Tell me where I'm doing bad so I can get better at it. I wanted to leave school at 16, because I hated education. Did I enjoy dental school? The answer was no. And I'm one of the very few people in the country who's got into a 3-year medical school and actually turned it down. There is a disadvantage to that. Do you know what the disadvantage to that is? To doing high quality work on the NHS.
You might not get paid as well.
Yeah, you don't get paid. Life is tough and you're going to fucking suck it up and move on. The reality is, in that point in time, when the shit is hitting the fan, you're Batman. You understand? I hit this artery again and the blood shot out of his mouth and it shot maybe about 10, 12 feet away. And I'm like, oh, fuck. I've got an Instagram account. This sort of social media kind of patient, they're not the ones that I would want to treat. First of all,
in this episode, we're joined by Dr. Amit Patel. We'll go into the story of how he turned from a failing student who barely got into dental school to one of the most accomplished specialist periodontists in the country. How does someone who failed his degree the first time round end up as the ex-president of the Association of Dental Implantology? Well, his portfolio of cases speaks for itself, and he's lectured on the world stage many times. Today, he shares his honest thoughts on becoming clinically independent to young clinicians and breaks through to the reality of clinical practice. Pure, unfiltered truths gained from decades of experience. Not one to miss. Hello, and welcome back to The Young Dentist, a place where we ask pioneers at the forefront of dentistry the questions that you, the young dentist, want answering. I'm Afif.
And my name's Fahim, and today we got Dr. Amit Patel. How are you, man?
I'm good, thank you. Thanks for inviting me on this podcast and getting me to travel all the way down to London.
Thank you for coming, man.
This, yeah.
100%. I mean, first things first, I want to say to the audience as well, is that the first time I heard you speak was at Joe's event. So this was at June 8th, Fast Tracking Your Future.
Oh, yeah. That's where I met you, yeah. You came and spoke to me in the bar office, yes, I do remember.
One thing that I realized, and a lot of people realize about meeting you, is you say what's on your mind, right?
Yeah.
Explain about that. Like, where did that come from?
And have you always been that authentic person?
So, yeah, I do say what is on my mind. And I've always been like that. I suppose because my mum and dad have always been like that. They'll say to me, if I'm rubbish at something as a kid, they weren't going to say, carry on and you might do something. They said, if you were shit at something, then you had to stop, right?
Yep.
And I think that's where I've got it from. My parents are very, frank, and they just, they always tell me the truth. Yeah.
I think is well with that, because I find it quite useful to hear advice from someone like yourself, is because it's quite direct. It tells you what you need to hear.
Yeah, but there is a problem with that, with the way obviously I can be direct, but I have to gauge, so when I'm talking to someone and, I obviously don't want to upset them. My aim isn't to upset them. My aim is, to hopefully guide them to do what they want to do. But, the thing is, when I'm being direct, because I want you all to do the best you can be, right? And sometimes we live in a world, and it's becoming more prevalent, that people just tell you what you think you need to hear. And I think I just don't agree with that. Do you know what I mean?
Yeah, 100%. It's very important how Stephen Harvey can tell you how it is, otherwise you just go on the long track and keep.
For example, right? So I was skiing in a place called Vale some years ago, and I was at some lessons, and they're Americans, and this ski instructor was this old dude, really good guy, and I'm sitting with these other Americans. There's like 3 of them, and they were like saying, the instructor was giving them feedback. He goes, "Oh, you're doing very good," and all this sort of bullshit. And I just said to the guy, "Listen, I don't want you to tell me if I'm doing good. Tell me where I'm doing bad so I can get better at it, right? Or do something different." And he was shocked by that. And the other Americans, they were like, yeah, you tell me how I'm doing bad so I can do better. I'm like, what? I don't want to be told I'm good at something, right? Because I know I am. right? Because you're not going to do it otherwise, are you? Does that make sense? And I think, we don't want to be all fluffed up and made sometimes to feel special. And there are times, but I find that very frustrating. I mean, I remember I did things have definitely changed. I'm 52 and I went to university at Liverpool, and, you were told you were rubbish at something, and that was fine. It did not break me. It did not upset me. I did whatever I had to do to just get the degree, right? And I did one of these training the trainers course where you're supposed to teach people and all this sort of stuff, and they need to know how you're supposed to teach them and give them good feedback. And I loved it in the sense that, things had changed so much when it was like, so Fahim, where did you think you did well there? Where did you think you did bad? And I'm like, well, just get to the crux of this, the situation.
Yeah.
But things have definitely changed. And I'm sure there are positives to that. But I'm the kind of person who wants to hear the truth.
Very interesting.
But obviously not everybody wants to hear that. So when I am blunt to people, I'm not that upset then. So I am much more cautious in how I say it. But if there's a point I need to say something, I will say it.
Very interesting there. You mentioned briefly how you went to the University of Liverpool, right? And in a brief exchange before this podcast, you were talking about your unconventional journey into dental school. To talk us a bit through how it was getting into the dental space, and I'm sure you got lots of listeners.
Yeah, I mean, so for example, I'm not like the typical Asians, kid. My parents weren't massively fussed what I did, and I wanted to leave school at 16, because I hated education. I loved school. I had fun, but I wasn't the brightest of kids. I was average. And my mates went on to do their A-levels. I then went to the sixth form college in the same school to do my A-levels, and didn't do very well in my A-levels because like I said, I'm pretty shit at that. And before I did my A-levels, the careers teacher said, well, what are you going to do? I said, I don't know. And he says, are you good with your hands? I said, yeah, because I used to do, it was called CDT, Craft Design and Technology by then. I don't know what it's called now. And I enjoyed doing that. And he said, well, be a dentist. I'm like, okay. And that was it. There was no other reason for me to be a dentist. So, and I went, all right, fine. And back then you needed a B and 2 C's. Okay. And obviously back then, it may not be the case now, but if you wanted to be a dentist, you were a failed medic, right? So, and I'll explain that to you later on. So essentially, I think you needed like an A and 2 B's to get into medicine back then. And then you need a B and 2 C's to get into dentistry. So I went to the interviews. So I went to loads of interviews, and it was the first time I'd left London, and I went to Sheffield for an interview. And obviously, because I'm a London boy, I wanted to stay in London because, there was nothing else that existed outside of the city of London to me, right? And so, I got on the train to Sheffield, and I went for my interviews, and I went to Bristol, and it was like the first time I've been on a train on my own at the age of 17. And it was like, a bit scary, but it was cool. And then you go to these interviews, and the interviews went bad because they asked me, why do you want to be a dentist? And I'm like, I don't know. So I never got a place, right? And then I sat my A-levels, and I got CEN. So you know what an N is?
No. Near miss.
N is a near miss, right?
Okay.
It means you didn't get an E, right? It means you failed. Okay. So, and I remember this because I was watching Terminator 2. That came out in the cinema like the week before my A-levels, and I came home, and I opened this envelope from my parents, and I was like in bed, and I was like, shit. And there's me thinking I was going to get really good grades because I thought I knew what I was doing. But I was stupid and arrogant, right? And I didn't know how to learn. And anyway, so I then, decided to resit my A-levels, and I went to a grammar college in Hendon. And my brother was taken out of the same school, and we went to this grammar college, and we both learned how to sit the exams and learn the stuff. So then I got, 3 B's this time, and you only have to get in with 3 B's. So I went to all my interviews again, and I got rejected straight away from all of them because I failed, right? And I went to Liverpool, and it was the most easiest interview. And the guy just says, "So we assume you've had no offers." And I'm like, yeah.
Now, before we continue, I want to take a minute to thank our sponsor, Colgate, for making this podcast possible. Colgate is on a mission to support the next generation of dental professionals as they transition from dental school to practice. And they aim to do this through the Colgate Student app. Now, the Colgate Student app is a completely free to use one-stop shop for all dental student education. It contains bite-sized educational content and clips to teach you the skills that you might not have learned in dental school, but that you'll need in real-life practice. The app contains 4 main sections: clinical practice, practice management, having fun, and doing good. It's super easy to use and has something for everyone, no matter which stage in your journey you're at. Now, students and young dentists ask me all the time, "Fahim, how do you know what events are happening next?" Well, within the student app, there's a specific events section containing exclusive student events, both in person and online, across the country. So you can network your way into those amazing opportunities. All of the content in the app is created by credible sources from across the globe, including the UK's very own University of Manchester, ensuring you have access to world-class support throughout your journey as a young dental professional. Click the link in the description to download the Colgate Student app today. And now, back to the episode.
And he goes, "Would you like an offer?" I said, "Yes, please." And meant to be the same. Yeah. And he said, literally, it was just one. I know I know the clinician who interviewed me. That we didn't have anybody else, just me and the clinician. And he said, "So what grades would you like?" I said, "I prefer 3 E's." And he goes, "No." And that was it. So, and then I then sat there my A levels and got 3 B's and went to Liverpool. And it was quite funny because my mum, my brother's like a year and a half younger. He's a year below me, and we both left the school, the house at the same time. So it was too instantaneous that they lost their kids at the same time. And my mum dropped my brother off at Birmingham. My mum and dad dropped him off at Birmingham, and I was in the same car, and we went on to Liverpool. And my dad says she cried all the way home back to London because she'd lost 2 boys.
Yeah, same side. Yeah.
It was kind of funny, really, but. He went to Aston, my brother. But anyway, so I turned up at Liverpool. I was like, "What am I doing here? It's not London." And actually, it was the best thing that's ever happened because my friends who stayed in London did not develop as individuals. Yeah. And I became very much more independent. I was doing my own stuff. I was in a small city, a student city, just having a really good time. And I was having fun. Every night we were out and just meeting loads of people. It was amazing, So I loved my university time, the university itself, right?
Yeah.
Did I enjoy dental school? The answer was no, right?
Really?
So we did OpTech in the first 3 months or whatever, for the first year. So turned up in the first 3 months, and I was like, "Well, we're drilling these teeth and stuff." And, I enjoyed it, but it got boring. I'm like, is this all I'm going to do? Right. And I realized, maybe this isn't the career for me, but I was going to finish it because I'd started. Right. And again, because I'm not a good student, I did do well in lots of exams. Right. I passed first year. Second year, I had to resit because I was a rubbish at it. Third year, did we have exams in third year? Yeah, I had to resit in third year as well. And fourth year, we had no exams, so that was good. And then we had finals, and finals didn't go the way it should have done. I failed one exam by 2%, so I had to go back and resit it. Orthodontics and pediatrics. No one's ever failed it at Liverpool. So I did that, but I came back and passed it. And, so for whatever reason, I failed it. The rest I did very well in. But during my Liverpool university, when I was at Liverpool, we did a stint at a hospital in Waltham. It's a maxillofacial unit. So I turned up with a friend of mine. Her name was Athena. So we turned up. We were there for a week, and this was in year 3. Yeah, and they had this guy's neck open at 9 o'clock in the morning, and I'm like, there's like all these surgeons, and I'm going, "We're dentists. What are we doing here?" And he goes, "Yeah, we're dentists too." And I'm like, "Really?" So, and then they, there was the most coolest week I had. Because they realized that I was enthusiastic. If I'm surrounded by people who are enthusiastic, I will definitely latch on. And so they used to get me plating zygomas, and they used to let me plate jaws and stuff like this. And it was just the coolest thing. And they'd just get me up from lunchtime to, Amit, come and help us with this surgery. And I loved it. And as a consequence of that, I thought, you know what, I'm going to do max fax. So I thought, you know what, these guys are cool. I'm going to do medicine after dentistry. And so I passed my degree finally, came back as a house officer, and I really enjoyed that. It was so much fun, just getting to do, just lots of different experiences of different specialties and actually learning to be a real dentist. Because when you're a dental student, you're only sort of, treating this, that, you know what I mean? There's not always a consistency. And then I did senior house officer jobs for 3 years all over the country. I used to work in UCL, and I worked at Liverpool. I worked in Doncaster, which was really cool because we got to do, just fixing broken jaws, stitching people's faces up. It was an amazing job. It was fun. And then I got into medical school. So I got into a 3-year course at Leeds. And but at that point, they started setting up a specialist list in dentistry. So you could be a restorative dentist, a fixed removable prosthodontist. So you can just do crown and bridges and dentures and stuff, or endo or periodontics. And I did something called vocational training. I think it's called foundation dentistry now, right? Foundation training or whatever it is. Essentially, I did that because I thought, you know what, I should get that out of the way so I could still be a dentist if I don't like medicine. So I did that, and I watched this endodontist work in Manchester, and his name was David Cohen, and him and Phil Green ran an amazing specialist practice in Manchester city centre. So we spent a day there, and then I was like, God, this endodontist is just so enthusiastic, and he just made it look easy, and it was fun. And then I thought, you know what, let's speak to him and let's look at what this specialty does. So I went out for dinner with them, the periodontist and the endodontist, and they just sort of said, the periodontist said, are you good with a scalpel? I said, yeah. He says, then do perio. I was like, okay. And that's what I did. So I deferred medicine for 1 year, got into Guy's to do my perio training. And the interview there was hilarious. I remember this. It didn't go well, to be honest, because they looked at my CV and it said, max fax, right? And back then, trying to get a job to do a proper hospital job in dentistry was not easy, and you couldn't find them. And this particular consultant said to me, your CV looks like you should be doing max fax. So I'm obviously lying to him that I've actually got a place in medical school. And I'm one of the very few people in the country who's got into 3-year medical school and actually turned it down. Right?
Oh, wow, okay.
Right? Because I'm now a periodontist, right? I mean, I made an informed decision. So he was like, it sounds like you should do medicine. I'm like, no, I'm trying to make an informed decision. I want to do perio. I didn't know what perio was. All right. And then I got on the course. And one of the reasons why I got on the course is because there weren't many British candidates. So my interview was very bad, but they were forced, I think, to give it to me.
Oh, yeah?
Yeah. So anyway, started the course. And there's an amazing clinician called Alan City who works in Harley Street. And he was just an amazing mentor and inspiration to me. And essentially, he only taught me 1 afternoon a week. And he was just the coolest dude. And so I'm there going, there's all these other students. They're all enthusiastic about perio. And I'm like, what is this? Right? So I knew nothing. And I sat with him. I said, Dr. City, could you teach me how to clean teeth properly? Root planing. We used to call it root planing or subgingival debridement. Now, and I didn't know how to do that because we weren't taught it at university, right? Or I wasn't there, I wasn't listening, which is usually the case. And then he taught me how to do that. And then I said to him privately, I said, after 6 months, I said, I'm going to go and do medicine because this is not floating my boat. And he goes, come to my practice and see what you can, see if this will change your mind. So I went to his practice and it was wicked. So do you know what a sinus lift is? No. So essentially, if you haven't got enough bone in the sinuses, the maxillary sinuses, you have to augment that by lifting up the sinus membrane. So what it is, you have an egg. If you have an egg and you remove some of the shell and you gently lift up the membrane without perforating it, that's very difficult, isn't it?
Yeah, of course, because you need copper, yeah.
No, but it's an egg, right? You could pop it. So that's the same principle in the sinuses. So you're doing this. So it was wicked. So he was doing that, and then doing bone grafting and all this sort of stuff. And I thought, you know what? I think maybe I should stick with this. And he was amazing because even though I was a student, he let me do some of the procedures. He goes, yeah, why don't you have a go at doing the sinus lift? I'd never done one before, but he had faith in me, right? And there were students that were above me and people that qualified that never done this sort of stuff before. And then I decided then to just, I sent an email, a letter back then. I sent a letter saying I'm not doing medicine. And that was it. So I carried on. Again, I didn't enjoy my peri training because it was not what I expected from it. But I knew where I was going to go, you know. So yeah, my journey has been very, you know, it hasn't been straight. And I think if it's straight, I think that's wrong. I think it has to meander because you've got to make decisions, you know. And even now, you know, I'm still meandering. I'm not that focused on where I want to go. You know, I mean, I was the president of the Implant Society, the Association of Dental Implantology. I'm the first periodontist to ever be the president of that society, and that happened all by accident as well.
Oh, wow.
Wrong place, wrong time. Right? They invited me to be on the committee, and I was like, I don't think people are going to vote for me. He goes, oh, you don't need to, be fine. And then the next minute, I got voted in to become the president. And now, because of the changes we made within the society, I'm now part of the European Association of Osseointegration. So that's a much bigger organization. And I'm on their committee, and I don't know where that's going to take me. But, you know, do I want to do a similar role in that? No, it's all politics. I'm not a politician. You know, I just want to get things done. But yeah, I'm just still meandering. So my journey has been complicated.
Yeah.
But what am I saying about that? I think when I meet a lot of young dentists, or young students, you know, education has changed quite a lot since I was a kid. But you're all much more focused. And I think that's a good thing. But I also think it's a bad thing because, you know, how are you going to find out what else exists? Do you know what I mean?
Yeah.
You know, if you think you have this end goal, you know, well, what happens next? Do you know what I mean?
Yeah, I was going to ask you about that as well, because I feel like there are a lot of dental students, new grads, who have been thrust into this world of dentistry, which is ever growing now. And they lose their sense of direction, think, do I go this way? Do I go that way? What should I do next? I mean, they see everything on social media and people doing so well and the false images that people portray. What would you say to those young dentists, young graduates?
So it's interesting you say this because almost every year for the last, 6-7 years before lockdown it started, I would get someone contacting me from universities. They've just qualified and they say, I want to be a periodontist. And I'm like, and I'm trying to be kind because it's like, well, what makes you think you want to be a periodontist? Because you ain't got a fucking clue, right? Because you're just you're not even a dentist, you know. I mean, you know, they've not done hardly any clinical work in those 5 years. You're all super smart academically. I was never smart academically. I always scraped through. But all of you students are so right. It's amazing to see that. But then clinically, you don't have that skill set. Does that make sense? So you need to be a dentist first, a general dentist, learn how to do some dentistry, and then develop an interest in a certain part. And you can't just say, I'm going to be a specialist in whatever, or yes, you might say you want to do medicine because you didn't enjoy dentistry. That's a different kettle of fish. So it's interesting when I meet people like that, and it's like, well, you know, I say to them, so how much debt have you got? And then they'll say, you know, whatever, tens of thousands or £100,000. I mean, when I was a student, I didn't have any debt because the council paid for my education. And so now, you know, when I went to do my perio training, the amount of money I had to pay to do that was hardly anything. And now, if you want to be a specialist, you have to spend, I don't know, £12,000 or £15,000 a year for 4 years. It's a lot of money. And I spent maybe 12 over 4 years right? So things have definitely changed. So I say to the students, I said, so how much debt have you got? They say 80 to 100,000. I said, well, you want to go and add more debt to that, and there's no guarantee you're going to get a job straight away that's going to be earning the potential you think you want to earn. And then, but they're so focused, they don't see, the wood for the trees. Does that make sense? So, I mean, what I'm trying to say is it's important to try to just enjoy the job for what it is, and then make an informed decision, right? So I've got a good friend of mine, his name's called David Breton, and he's in Newcastle. He's, I met him, I was teaching on a course, and this young guy out of university, confident chap, really funny, and we got on so well. I'm like, what the hell are you doing on this course? He goes, well, I really want to learn how to do lots of general dentistry and try to be good at it. So I think he's a really smart guy. He's a very successful guy. I think he's only just turned 30 or 31. And what he was doing high quality work on the NHS, right? Now, there is a disadvantage to that. Do you know what the disadvantage to that is, to doing high quality work on the NHS?
You might not get paid as well.
Yeah, you don't get paid. You get paid nothing, right? So you still getting paid NHS fees, but you're doing it so high, and you might spend hours to do the work, but you don't get any money. The money you're trying to get. Now, why do you think he did that?
Just so he can improve his clinical skills.
Yeah. And what was the plan?
To eventually go by shift
to private.
So can you see the difference?
Yeah, that mindset change, right?
So that mindset was amazing what David did, right? And he's amazing in his own social media, and he's a good guy. I really genuinely like him, and I'll do anything for him. And he worked his tits off to do high quality work, took photos, showed the work. So when he made the move out of the NHS, 5 years time, 6 years time, afterwards, he had the portfolio cases and got into an amazing private practice and runs it, and works in a high-end cosmetic clinic in Newcastle.
Yeah.
And so it didn't matter what you didn't make in those 5-6 years. Because now he's flying.
Yeah.
Does that make sense? So you need to think long term. Problem is, you all qualify and you go, I think I need to be earning £100,000 a year, whatever the fuck you think you deserve, right? You can't make that if you can't be a good dentist. Does that make sense?
100%, yeah. So, Amit, you mentioned there briefly, right, about you being a student not learning too many clinical skills. A lot of it's academic, right?
Yeah, that's what it is nowadays, bro.
So how would you recommend you can maximally utilize your time? Is it just live a little, experience a life, or how would you recommend making the most out of student life? And how was that for you?
How do you make the most of student life? I think the problem is, I mean, I don't know, but I think you should just enjoy university and have a good time. 5 years. I mean, the first 3 years are amazing because you hang around with art students and stuff like that. And after that, they've left. And then you start buckling down if you wanted to. I just think you just need to have a good time, because those university years are the best years, are some of the best years of your life. And they never come back, right? And if you spend that focusing on where you think you're going to be and how much you're going to work hard, because, end of the day, your degree is just a degree, right? Patient doesn't know if you got distinction. My patients don't. I mean, I tell them I failed. I love telling them I failed my degree, and they find it hilarious, right? But I have a lot of qualifications after my name, and I've done relatively well. So it doesn't matter what you have done before. It's what you grow into. Does that make sense? It doesn't happen. It just doesn't happen overnight.
Yeah, it was good.
And so I think it's important that you enjoy the university and network and have fun, because after that, you have to grow up.
Yeah.
You have to pay bills, and it's not the same.
Yeah. Yeah, the reward.
Yeah.
I think you said I was watching another podcast that you did earlier today, and you mentioned how dental students nowadays are almost primed and prepared to become the best of the best. So they've got this mentality that they need to be the best of the best, and that anything less than the best is a failure. So linking to this topic, what would you say about that? Be honest.
Yeah, I am going to be honest. I mean, look, I have made tons of mistakes in my life, right? And, and I remember this when I failed finals because I said the wrong thing to a particular clinician. And when I failed finals, I had a viva, And the pediatrician, I went and saw him. I said, can you explain to me why I failed? I missed it by 2%, 48%. And I'm not the worst student. I think you can gather probably not one of the worst students because of the position I am in. So, and the rest I got like 68, 65%. So there's no way I was supposed to fail that exam. So I went and saw the pediatrician and he said to me, oh, I didn't think you failed. And I then spoke to the orthodontist. And back then we had no recording devices, no mobile phones, nothing like that, right? I turned up and I spoke to him. And he goes, you failed because of your attitude. And if you don't change your attitude, I will fail you again. Now, that doesn't happen nowadays, right? Now, I was so angry. And I'm not the kind of person who can control his temper, right? I will lash out and get violent if I have to, right? But he made me so angry. And I remember when I failed, it was like, what have I done? And I realized, I had to pretend to be something that I could never be, right? But anyway, so now that I think about it, yeah, I failed. It was shit. But actually, it was probably a good thing that I failed because there's no way I'd be in this position. I might have been just a general dentist and I would have been running a nice practice, been quite content. But, the path has taken me down this path where I met you two, I've met Joe Lover and all these individuals. And I've been very lucky that I know some of the best clinicians around the world who'll help me, who'll let me go and watch them. I get to lecture all over the world and do lots of cool stuff. But I think if I didn't fail, I don't think that would have happened, right? So I think today, especially when you look at a lot of the kids that go to university, I mean, this year I had some A-level students come and watch me in practice, and they're all privately educated, or they're all gone to grammar schools or whatever. They're all super bright, but they haven't failed in their life. So when they become students, they haven't failed. So they don't know when something bad happens, they don't know how to cope with it. Do you know what I mean? Yeah, okay. Maybe somebody, in your family might have died or whatever it is, then you'll learn to become a bit more resilient and learn to manage that. But when when something bad happens to you, how do you cope? And I think a lot of people are struggling with that because they don't know how to deal with stuff. Do you know what I mean? And I think this is an issue for me. And this is why I think, if you work in the NHS for a few years and just learn how, people might be rude to you or whatever, and learn how to manage these. You go home and you think, shit, that day was so bad. Why have I got myself in this position? Does that make sense? I mean, I've heard recently some foundation dentists are struggling. Now, they're struggling. I'll tell you. Do you want to give me any ideas on what they're struggling on?
Yeah, so maybe they don't have the same level of patient exposure, so how they get treated in the clinic might be different to what they were expecting.
Yeah, exactly. Because, when you're at university, you might be seeing one or two patients a day, right? Or two patients a day, right? One in the morning, one in the afternoon, right? And suddenly you're now seeing 10, 20 patients a day, and you're struggling to cope with that, right? And I think that's the problem, isn't it? Because if you're in a situation where patients, you come in and you see your day sheet and you're overwhelmed by that, how are you coping with that? I turned up and did my first VT job. I'm like, it didn't bother me. I was looking forward to seeing these patients. But obviously something has changed in the way people are educated or the society we live in that I'm not aware of, and so some of them are saying, I can't cope with the number of patients. It's overwhelming. I can't go in. In the real world, you'll get fired, right? I mean, how are you going to pay your mortgage, right? How are you going to pay your debts off? And if you're living with your parents or whatever it is, how are you going to help them pay bills? Do you know what I mean?
Yeah.
And I think that is a matter of, I don't know if it's a matter of growing up, but being aware that actually, life is tough and you're going to fucking suck it up and move on. Do you know what I mean?
I mean, you must have been in some situations being periodontist, doing implants and things. It's high stress.
It is stressful, yeah.
Has there ever been a time where you kind of had to have your head in your hands and think, what is going on here? And how did you get out of that? How do you cope with that?
A good friend of mine, Paul Shenfine, said this to me only this week, and it was really funny. and it's very, very valid. And there was an old TV series called Batman, right? And it was very, camp and quiche and stuff like that. It was quite, funny. So Bruce Wayne was captured and put into a dungeon, and he's sitting there and he's got his hands tied up and he's going, oh, Batman's going to come and save me, right? Then he realized that he was Batman, right? So this is what Paul's telling me the story. And I'm going to find the episode and use it in the lecture. But essentially, he then escapes and then does what he has to do to get out of the whole thing. And Paul said to me, he says, the reality is, in that point in time, when the shit is hitting the fan, you're Batman. You understand? So you're the only one who can fix it. Does that make sense?
Yeah.
There's nobody else. You're not at dental school. No one's going to help you, right? And this is why I did my max fax jobs and house jobs, because you know what? I was the one who had to deal with it. And yes, I knew somebody was around, but I never asked for help unless I needed it, right? So in practice, I was in a sinus lift on a really lovely patient. And so it was the right side. I did the sinus lift on the right side like a month, one day, and I hit an artery. It stopped bleed. It bled a lot, and it stopped bleeding. And I carried on with the sinus lift, put the bone and graft in, stitched them up. Came back a month later to the other side. So the anatomy is the same. There's an artery running along the maxillary wall, right? And it's quite a big one. So I did the left side, and I hit this artery again, and the blood shot out of his mouth, and it shot maybe about 10, 12 feet away. So it was really, and I'm like, oh, fuck. And I tried putting my finger in there to stop it, because you can't, once you cut the artery, so if you got a bony wall, the artery runs along inside it or on the outside, but in this case, it was running inside it. I removed the bone, I hit the artery, and as soon as you cut the artery, it then shrivels back, so you can't find it. It's inside the bone, so it's just oozing, and the blood was filling up to the top of his bottom teeth, on the incisal ledge, and I'm like, oh, it just kept filling up, and I'm there suctioning, and my nurse is like going, this isn't going well, and my receptionist is like, all right, and the patient we're there for about 20 minutes, 30 minutes, and I just try everything to stop the bleeding, and he says, do you think we should call the ambulance? I say, yes. Now, I was shitting my pants, right? But I didn't show it, right? And my team were like, you did not show any, worry or stress, because I had to be the one in control, right? If I was showing any fear, the patient would have had a problem. Anyway, the ambulance turned up, and the ambulance guy says, oh, it's just an extraction. I'm like, no, look at this. And then we got in the car. It was in a car. I had my thumb in his sinus. Turned up in A&E in a big hospital in Birmingham. And it was really bad. Essentially, nobody in the hospital wanted to help me. The consultant in A&E was like, well, the ENT didn't want anything to do with it. Max Fax weren't there. And he says, well, you're the only one who knows what to do. He goes, what is it you want us? What do you want me to do? And I said, I want this. And I stopped the bleeding, right? But, it was really cool. But the patient had confidence in me, and we found out he lost 2 pints of blood from that procedure. But we've been friends ever since, right? Me and the patient. But bad things happen, but you got to learn from it. And it still scares the shit out of me now when I do a sinus lift that I could do this. And I spoke to loads of people. Has this ever happened to you? No. I'm like, what? Jesus. But, the difference is I knew how to cope with that manager. And I suppose that's because I had all this hospital training, which is a good thing, because when you're sitting in practice, and like you said, you asked the question, have I ever felt, I need to bury my head in the things. So if I'm doing a procedure, sometimes it's just, even if it's this, something's not stitching up correctly and I'm just getting irritated, I suddenly will get up and I'll walk out and I'll go into another room and I'll just, take a break for like a minute, look at a CT scan or something that'll distract me from what I'm doing. And I come back and then it all goes back to normal because, it's like you just messing around. You need to stop, walk away, come back to it.
I see. Very interesting. And Amit, you mentioned a few names and some international speakers you also briefly referenced as well. How much international collaboration is there in the dental space?
You're right. I mean, there's obviously loads, especially now with social media and Facebook. And obviously, Facebook is the one with the collaboration initially. I think with Instagram, it's a very different entity now. But at least with Facebook, you could have some sort of proper communication backwards, forwards. And that's where I met all these individuals that
Oh, really?
I have. Yeah, that was the only way I met them. So there's like, a chap called Howard Gluckman, who's an amazing implant dentist in South Africa. A good friend of mine called Ricardo Kern, who's in Brazil, who's one of the most talented soft tissue experts in the world. Another good friend of mine, David Gonzalez in Spain, who does amazing bone grafts. I've got tons of friends. And a friend of mine called David Kim, who's a professor at Harvard. Again, I knew him for 15 years. Spent time with him. Loads of professors in Italy that I go and hang out with. So, that sort of relationship has been useful. And I think for me, sometimes, when you build these relationships, people are much more cautious because they're very well-known individuals. But when they get to meet me, they realize I don't want anything from them. It's not like I needed to be just standing next to them and use their name to try to get me someplace. I just want their friendship.
Yeah.
And I want to just, hang out. And as a consequence, we just had really good friendships. So it's been really good. I mean, I've got friends who don't speak much English and they're writing books and they'll say, Amit, could you just go through this book with me and just try to correct the English or the presentation? I'm like, yeah, no problems. Nothing's an issue. So it has been fun and I've enjoyed it. I mean, there's a good friend of mine. I work in the University of Birmingham. I'm an associate professor there. Essentially, he's Ian Chappell. He's one of the most talented periodontists around, an amazing scientist. And he's helped me get to where I want. I mean, he's offered me a job when I turned up in Birmingham and suddenly, he put my name around and people just said, oh, let's, because Ian was such an amazing guy, they thought, oh, well, let's get to know Amit a bit. So it's been good. So it's been good in that sense. And I think, those sort of friendships are based, they build up organically, not based on any falsity. Do you know what I mean? It's not like I need something from you. And you have a real friendship there. And, these are people that, I'll text. And if I have a complication with a case, if I have a case I'm not sure about, they will contact me directly and say, this is how I deal with it. Others will do it, but, it doesn't happen.
Yeah, and I think speaking to a few dentists and newly graduated dentists, there is a thing where we hear all about, finding a mentor is very important. Finding friends in the dental space is very important.
But I think you need to find genuine friends. That's what you need. Somebody who's going to tell you the truth.
Can you elaborate?
No, just... So it is... Yeah, I will elaborate, yeah. Because essentially, the problem is, you're all students and you don't know who's good. That's a fact, right? And someone like me, who's quite an old fart, will know who is good and who is bullshitting you. And the problem is, we now live in a world where everything is fake, right? So social media... I've got an Instagram account. It's bullshit. I mean, I'll be sitting there and someone says, you need to get more Instagram followers. Why do I need more Instagram followers? Right? It's not going to make me more money, right? I understand there is a way to make money with Instagram, but I don't need those patients, right? So I'll go back to that in a minute. So essentially, I just, I don't know, if you follow me, great. I just, patients give me gifts and cake and stuff. I just post that. And people go, that's not showing you what you do. That's actually showing what I am like as a person, right?
Yeah.
I don't need to show how big my balls are or how good I think I am. Does that make sense?
Yeah.
You need to make that decision based on me lecturing or seeing my work or my papers that I've written. Does that make sense? The problem is, social media, everybody's trying to sell themselves, right? And, going back to Instagram, I understand, young people using social media to, get these, to do ABC, align, bleaching and composite or whatever it's called, because there are patients who want that sort of cosmetic work, which is great, right? But I almost struggle when I see some of the dentists on it who almost look very unprofessional in the way they portray themselves. And then they get these patients, right? And I think that relationship between the patient and you, there's a boundary and it's crossed. Those patients come contact you directly. Think that's wrong, right? Because if that patient is upset about something, they can find you. but also they're happy to sue you. So they're not your friend. Does that make sense?
Yeah.
So when you're looking for these kind of social media, this sort of social media kind of patient, they're not the ones that I would want to treat. First of all, they don't have money, right? Because everybody has finance, right? People buy Rolex watches and cars and finance or whatever rubbish that you believe is important to you, right? But the patients that come to see me are in their 50s, 60s, 70s, and 80s. They come and pay in real money. Does that make sense? They don't turn around and say, I can't afford it. Yeah. And I think that's what I like about what my position I'm in, because I couldn't treat young patients with their high aesthetic demands. And sometimes you'd be thinking that those aesthetics are wrong because their body dysmorphic way of looking at life isn't, the golden proportions that we've been taught at university. Yeah, right? So I've become more cynical of that. And I'm sort of lucky in the sense I've got another maybe 15 years, but I'll only be treating patients, that are of a certain age, and they will value what I do. And they will not, they won't ask for something on the cheap, because you can't have something done quickly and done well and cheaply. It just doesn't work, right? Does that make sense? And I think all of you, when you qualify, you have to value yourself. And yes, you want to make money, but it will happen. It happens in time. It just doesn't happen overnight. But we're all wanted to get it very quickly. I was at an event recently, and one dentist was talking about another dentist, because, this guy, he's done all of this ABC stuff and he's driving this very expensive car and he's making on average, maybe £45,000 a month. And this is just one person. I'm not saying they're all doing that. And I was amazed at that. And I was pleased that he was making that sort of money. But you will burn out. You can't just, you know what I mean? You can't do that all the time. Yeah.
Yeah. And
I think you have to have a bigger picture. You got to think, you make a good living, but you've got to enjoy it as well.
I think that brings us on to one of the questions that we ask at the end of every interview.
The end of the interview now.
Yeah.
Because I've been talking too much.
And it's what does success mean to you?
It's not monetary. I think for me, success, like I talked about this guy making that money. And I was really happy for him, right? But I know it won't be sustained, right? So I think for me, success is about finding happiness, really. To be able to go home and the weight comes off your shoulder. If you've got no tense shoulders, then everything is going well, right? I think that's what success is for me, and also success is that, if you've, when you come to retirement, you're doing well, you don't have any struggles, you're just enjoying, your life, really. You know what I mean? Because you've worked so hard for such a long time. And I think that's what it is for me. I don't think it's not what you've achieved, because at the end of the day, no one gives a shit with what you achieved. Like I said to you, what did I get a distinction? No, right? Did I do well in my perio training? I did quite well in it, but there were bits in it that I've done well in that I've never told anybody how well I did, right? Because it's not important to anybody.
Yeah.
All right? It's just nice to know in yourself that you've done okay. Do you know what I mean? But when you meet people who just go, look, this is what I've done, and it's boring. Do you know what I mean?
I see. And Amit, if you had one message, to the young dentists out there, I know you mentioned lots of things. To distill it down to, one or two statements, what would you say to them all? Look in the camera if you could.
The problem is social media is here to be, part of our lives. And I think you got to use it in a smart way, but don't get so obsessed on it, I think it's very important that you build real human skills to meet real patients and build relationships, because once you build that trust, you will do well and be successful. And just take one step at a time. Don't focus 10 miles, 10 years down the road, because anything can happen. Do you know what I mean? And I think, end of the day, you're all going to do well. That's the most important. You've done a good degree. You're going to do well. Just take your time. That's what I say.
Awesome. There you have it, guys. Dr. Amit Patel, thank you very much for the words of wisdom.
Yeah, my ramblings. I could ramble for another hour.